Renal impairment is a frequent comorbidity in elderly patients with COPD. Since tiotropium is mainly excreted by the kidney, people with kidney disease who are treated with a drug may be at greater risk of adverse events. Hence, it is important to assess its safety in this population. Previously, the TONADO studies found the combination of tiotropium and olodaterol to be safe and effective in more than 5,000 patients with moderate to very severe COPD. In this subgroup analysis of TONADO, we evaluated the safety profile of the combination compared with either drug alone in patients with renal impairment. We only included patients treated with the marketed doses of the drugs. Renal impairment was assessed using creatinine clearance at baseline. Very few patients in the study had severe kidney disease. First, we looked at comorbid conditions at baseline. While many patients had comorbidities, we found no clear association according to the degree of renal impairment. We also found that the proportion of patients with adverse events was not related to the degree of renal impairment and did not increase with tiotropium in combination with olodaterol compared with either drug alone. Similar results were seen for serious adverse events. Fewer patients discontinued or discontinued due to adverse events with the combination compared with either drug alone. In addition, there was no increase in the risk of renal side effects or anticholinergic side effects with the combination versus either drug alone, regardless of the level of renal impairment. In this sub-analysis of TONADO, we found that over half of the COPD patients enrolled had renal impairment, and many had other comorbidities. We conclude that the safety and tolerability of the tiotropium-olodaterol combination is comparable to either drug alone in patients with mild to moderate renal impairment. Overall, our findings provide reassurance to doctors prescribing this combination to COPD patients with mild to moderate renal impairment.